Hi everyone, welcome to JNT YouTube channel. Today in medicine we'll be discussing one of the conditions that affects the brain, which is a cerebral vascular accident, abbreviated as CVA, which is also known as a stroke. So by definition, cerebral vascular accident is the central nervous system condition in which there is sudden impairment of cerebral circulation due to cerebral thrombosis, embolism, or hemorrhage characterized by loss of consciousness, hemiplegia, which is also known as paralysis, and cyanosis. It can also be defined as this is the sudden interruption of cerebral circulation in one or more blood vessels supplying the brain, resulting in permanent or temporal neurological dysfunction lasting more than 24 hours, characterized by sudden loss of consciousness, hemiplegia, aphasia, which is loss of speech, and loss of sensory perception. So when we talk of CVA, which is cerebral vascular accident, we are saying this condition affects the brain, and it deals with the blood circulation. So you'll find that the blood supply to the brain will be interrupted or will be impaired. As a result, the patient will have signs such as sudden loss of consciousness, and the patient may also experience paralysis, maybe paralysis of the left side of the body or maybe the right side of the body, and also cyanosis. So this is what the condition is all about. So here I have the diagram showing the types of CVA, or in other way, stroke. So stroke can only come as a result of three main things. It could be a thrombi, which is known as the thrombotic stroke, or emboli, which is also known as the embolic stroke, or it can be caused by hemorrhage causing cerebral hemorrhage. So this is the diagram, as you can see on the diagram here. So here this is the brain tissue, and it has got these blood vessels which supply blood to the brain. So there are two things here. There's a thrombotic stroke and the embolic stroke. So what happens in a thrombotic stroke is that there will be a blood clot. So the blood clot can form in the brain tissue and start blocking the blood flow to the brain, and that's what can cause about thrombotic stroke. Then we also have here embolic stroke, which means that an emboli, it may form. An emboli is also another form of a blood clot, or sometimes it could be air that can form. And the difference between thrombi and emboli is that an emboli, once it forms a clot, it starts traveling. It can form anywhere in the body, but it starts traveling through the bloodstream until it reaches the brain, where it blocks the artery supplying blood to the brain tissue. So that can cause the embolic stroke. Then the other one that we have is a hemorrhagic stroke. So in hemorrhagic stroke, we are talking about excessive bleeding in the brain, or in the blood supply to the brain. When they start bleeding a lot, it can reduce blood to the brain tissue, and it can bring about a stroke. So, and this can be either in intracerebral hemorrhage, the bleeding which occurs within the brain, or it can be subarachnoid hemorrhage, which means the bleeding can occur in the subarachnoid space, subarachnoid space. So this is what it means. So in hemorrhagic stroke, we are saying the bleeding can happen in two forms. It can be in intracerebral hemorrhage, which means the bleeding is just occurring within the brain tissue, and it can bring about a stroke. Or it can be the bleeding can occur within the subarachnoid space, which is a subarachnoid hemorrhage. Then so these are the types that I talked about: thrombotic stroke. So this is the part of the brain that is depleted of blood, and there is a clot here that has formed, which has interrupted the blood supply to the brain. And also here it's the same thing, which means the clot or embolism has moved to the artery supplying blood to the brain, and the area is deprived of blood. And also here, that's what I was saying about. I was talking about there's bleeding in the brain tissue under cerebral hemorrhage, and this can also occur as a result of aneurysm. Aneurysm, this is when the artery or any blood vessels has ruptured, and it starts causing the bleeding as a result of blood pressure. Then we start causing bleeding within the brain tissue. So this is what it means by stroke. So even when we are discussing stroke, this is the overview of it and how it comes about. So what are the causes, stroke types of CVA? So these sometimes in an exam they can be used interchangeably. Sometimes they can ask you to say explain the causes of cerebral vascular accident, or the causes of stroke, or sometimes can be explain the types of stroke. So these are the same things. Once you know the causes, you know the types. So like I said, so there are three types. Mainly there are three types. So we have cerebral hemorrhage, which is also known as hemorrhagic stroke. So this one results from chronic conditions such as hypertension, aneurysm, causing rupturing of blood vessels, supplying blood to the brain, leading to bleeding into or around the brain tissue. When a vessel ruptures, blood leaks into the brain tissue, increasing the pressure within the skull, which is also known as intracranial pressure. And this pressure can damage or kill the brain cells and restrict the normal flow of the blood, depriving the surrounding areas of oxygen and nutrients. So this is what I talked about to say in a hemorrhagic stroke, which means that the blood vessels or the artery that is supplying the brain has ruptured. As a result, there will be bleeding within the brain itself, or maybe just surrounding the brain tissue. So this is what happens, and this same blood that is the same bleeding can also cause the blood to be leaking into the brain tissue, especially if the rupture has occurred within the arteries, as occurred in the arteries within the brain. So it means that it can even start causing, it can also start increasing the pressure within the skull, which is intracranial pressure. As a result, because there's the pressure that has increased in the brain tissue, it will start now killing the brain cells. So which means the way the cells of the brain functions will be distorted, and it will restrict the normal flow of blood. And we know that blood carries oxygen and nutrients, and for the brain to function properly, it needs those things. It needs oxygen as well as nutrients. So if these are deprived to the brain tissue, it means that the normal functioning of the brain will stop, and also the brain cells will die because they cannot receive adequate oxygen and nutrients that are needed for their normal functioning. Then the other type that we have is cerebral thrombosis, which is also called thrombotic stroke. So here if they said write the causes, yes, either you say cerebral thrombosis is a cause, but if they mentioned to say write the types, you're supposed to write thrombotic stroke. So that's how you differentiate these two things. The explanation is the same. Then for this one, it happens this when the blood clots, which is the thrombus, resulting from atherosclerosis. And we know atherosclerosis is the buildup of fat tissues that blocks the arteries supplying blood to the brain. So you find that the fat, especially those people that like eating food that is of high cholesterol or high fat, so you find that the fat plaques blocks the artery, cause depriving blood to the brain, and this can lead to localized brain tissue ischemia and infarction. So ischemia, this is just the death of a body tissue as a result of ischemia. This is when there's reduced blood flow to the brain tissue, I mean. So ischemia, this is the reduced blood flow to the tissue, and as a result, if that continues, it can lead to necrosis, which is also death of brain tissue. So this is what happens. So in a thrombotic stroke, we are saying that the emboli, the thrombi is going to form, which is also a blood clot. And if it forms, it will start blocking the arteries that is supplying blood to the brain. And this can result into tissue ischemia, which is reduced blood flow to the brain because the passage where the blood moves is blocked by the fat plaques. So as a result, there will be ischemia and also infarction. Then also have cerebral embolism, which is also embolic stroke. So in embolic stroke, it means that when an emboli, which is the blood clot, or sometimes it can be air bubbles, it can form anywhere else in the body, and this happens commonly in the heart, lungs, and then it starts traveling through the bloodstream, blocking the cerebral artery, reducing blood supply to the brain. And as a result, it can lead to sudden cut-off of oxygen and nutrients to a part of the brain. And the affected brain tissue begins to die within minutes unless the blood flow is restored. So the only difference between thrombi and emboli is that emboli is the moving clot, and it can happen anywhere, like in the heart, lungs. Then it will start traveling. As a result, it will block the artery that supply blood to the brain tissue. And if that one is blocked, it means that the blood cannot pass through. As a result, the brain is deprived of oxygen and nutrients. Then we also have the other one, which is not very common, but it is also another type of stroke. So we have transient ischemic attack, which is also known as mini stroke. So in this one, you'll find that there is a brief episode of symptoms occurring for minutes, caused by temporal decrease in blood supply to the brain. So you find that in this type of a stroke, there will be a temporal decrease in blood supply to the brain, and it can be caused by many conditions. As a result, there will be brief episode of symptoms occurring within 30 minutes. The patient is experiencing just symptoms. Then we have predisposing factors to CVA, which is also known as stroke. So one, we have age of 65 years and above. Why? Because most people, especially elderly people, their blood vessels, they tend to be weakened. So as the person is aging, the blood vessels weakens, and sometimes it can also narrows. So as the blood vessels are weakening and narrowing, this can bring about stroke, because it can predispose someone to have hypertension. Because of the age, somebody can have hypertension, and hypertension increases the blood pressure. So if the blood pressure is increased, it means that the delivery of oxygen to the brain tissue is reduced, because the pressure is not moving at a normal pace. It's high, but the delivery is low. Then also men are more affected than females. So in men, what happens that most men are more associated with this condition, are at risk of hypertension and these other conditions than female. So that's why you find that in CVA, men are more affected. Then race, you will find that Black American are more affected. Then hypertension is also a predisposing factor, and especially the common predisposing factors. Most of the patients who are hypertensive, the common complication that happens is a stroke, which is CVA. Because hypertension, it can because of increased pressure in hypertension, we find that the patient, the blood vessels may be ruptured. In another term, we call it aneurysm, where there is a rupturing of blood vessels as a result of increased blood pressure. So as the blood vessels ruptures, the patient it will start bleeding. Sometimes it can be bleeding within the brain tissue, like we said, intracranial bleeding, or it can be bleeding within subarachnoid space of the brain tissue, which is can also cause stroke, like I said in the previous PowerPoint. Oh, sorry, in the previous types. Then also we have in hypertension. Also, you find that also the delivery of blood to the brain will also be reduced. Another predisposing factors is the atherosclerosis. Atherosclerosis, this is another thing that we said, whereby there'll be there'll be deposition of fat plugs within the blood vessels. As a result, they'll block the blood vessels, and those fat plaques are the one that forms the clot. So they will block the blood vessels, causing thrombotic stroke or embolic stroke. And also diabetes mellitus. So this can occur as a result of micro or macrovascular changes leading to atherosclerosis. So this is things to do with fats and also high cholesterol levels. So when these fats they are deposited within the blood vessels, they start narrowing the blood vessels and also blocking the blood vessels. So that's how diabetes mellitus can bring about stroke. Also, family history of stroke. This stroke tends to occur in family. If one member of the family had a stroke, there's also a high chance of another person having a stroke. Also, oral contraceptive. So oral contraceptive can also bring about stroke. Why? Because of the estrogen. Estrogen that is found in the oral contraceptive promotes clot formation. So as a result, it can bring about stroke. Also, cigarette smoking. In cigarette smoking, we know that in cigarette there's a nicotine, and this nicotine is a vasoconstrictor. It constricts the blood vessels. Once the blood vessels constricts, it will increase the blood pressure, causing hypertension, which can lead to stroke also. Again, also alcohol consumption. So alcohol consumption, it can damage the cells that are responsible for clotting factors because of alcohol consumption. And also alcohol also can also trigger the heart rate also during atrial fibrillation. So which means that it can trigger heart rate, and the heart can start pumping a lot of blood, increasing the blood pressure and reducing the blood flow to the brain tissue. So now let's look at the signs symptoms of stroke. So signs symptoms of stroke, we have these signs and symptoms that vary according to the artery affected and severity or extent of damage. So this is how these signs and symptoms are classified. So they just depend to the artery affected. If the artery that is affected is from the left side of the body, then that's the part that will be affected. Or maybe also severity. if it is less severe or more severe. So we have one sudden loss of consciousness. This is due to interruption of oxygen to the brain. So when oxygen is interrupted, is not supplied to the brain, the patient start losing consciousness. So that's why this some signs is coming about. Then you also have paralysis, which is also hemiplegia or hemiplegia. Hemiplegia is a numbness. This one can either be on the right or left side of the body, depending on the part of the body affected. Can be paralyzed or the patient can feel numb. Then we also have aphasia, which is a loss of speech, and this is due to brain cell death. So you find that the cell of the brain will die. As a result, the patient will start losing speech, because the brain is the control center of the body. How we move, how we talk is controlled by the brain. In the way we see things, the things we hear is controlled by the brain. So if the brain is dead, the brain cell is dead, it means that even all these things will be affected. Then also frequency, urgency, and urinary incontinence. This is another common sign symptoms of stroke due to effect on the nerve innervating the urinary bladder. So you'll find that the patient who are having a stroke, they can be passing urine frequently or urgently, which means that without even aware, or sometimes it can be urine incontinence. The urine is just coming out continuously, which means that the muscles of the urinary bladder cannot hold the normal flow of the urine. So, and this happens as a result of the nerves that are involved in innervating urinary bladder if they are affected. So this is very common. It appears mostly in a patient with a stroke. There will be also loss of sensory perception, especially in tactile, visual, auditory perception due to impaired stimuli in the brain. So tactile, we are talking about touch, sense of touch. So you'll find that the patient can be losing sense of touch, is not feeling anything. And also visual, also even the things that the patient can be seeing things that are outside the surrounding. And also auditory perception, also can be hearing things that are outside the surrounding. So this is due to impaired stimuli in the brain, because those are the stimuli, that are responsible for censoring things in the surrounding. They are impaired. So in patient like this, you may even be hearing, no, I'm hearing something on my body is moving, something is doing what? That's just a perception. It's not even true. Or they can be even seeing things. I saw this, I saw that, I saw what? Things that are not there. In our tradition, we can even start saying like as if it's witchcraft. Wow, it's not. It's just the impaired stimuli in the brain, and also auditory, where they are hearing wrong things, voices of the dead. So this comes as a result of impaired stimuli in the brain. Then we also have cognitive impairment, such as the loss of memory, loss of reasoning. So this can come out as a signs symptoms in stroke. They cannot remember anything. Sometimes they cannot even reason well because of the brain cells that are involved in cognitive are impaired. There can be also headache and neck stiffness. So we talked about increased intracranial pressure. So if there's increased intracranial pressure, it means that even the patient can be feeling headache also. Also, gradual onset of dizziness, mental disturbance, and seizures. This can result due to the death of brain tissues or brain cells as a result of also increased intracranial pressure in the body. In the brain, I mean, it can bring about these signs. Then let's talk about the medical management. How do we manage stroke? So we start with the investigations. So under investigation, do history taking. So history will be done to review the risk factors such as hypertension and the family history of stroke. Then also CT scan will be done to review the site of infarction and the hematoma. So if they scan the brain or you'll find that the site that is affected and also where the hematoma is forming. Hematoma, that's the area where there is accumulation of blood in the body tissue. In this case, we are saying the brain tissue. So the hematoma will form there. So it can be seen on the CT scan. Then MRI will be done to review the site of infarction and it provides more detailed images of the brain tissue. So it will review the tissue that is affected and also the site of infarction. Then EEG, which is the electroencephalogram, will be done to show abnormal nerve impulse transmission and record electrical activities in the brain. Then also lumbar puncture will be done for cerebral spinal fluid analysis, which is the CSF. Then in cerebral angiography to visualize the blood vessels in the brain and pinpoint the site of rupture. Carotid Doppler ultrasound will be done to assess the blood flow in the carotid arteries, especially the major arteries in the neck that supply the brain. Treatment. So treatment, we are talking about the drug that can be given in a CVA. So one of the drugs that can be given is a tissue plasminogen activator, which is given to burst the clot, and it is given to the patient within 3 hours window of stroke occurring. So this one, immediately when the patient is having stroke, especially in severe cases, that is where it is given. So within 3 hours. Anticoagulants, we give heparin and warfarin to prevent further thrombosis. So heparin is given 10,000 to 20,000 units 12 hours. So these drugs, they prevent clot formation, and that's why they are given in stroke. Antihypertensive drug, especially if the cause is Hypertension, you give infedipine to reduce blood pressure, which may cause intracranial pressure and cerebral edema in the brain. So antihypertensive drug is given infedipine, and platelet, that is aspirin, is given to prevent platelet aggregation, which may lead to thrombus formation. Then also dexamethasone and mannitol, it is also given to reduce cerebral edema. Also antacid ranitidine to reduce risk of DIT hemorrhage. So this one is given. And epilepsy also can be given barbiton to control and prevent seizures. So let's say if the patient presents with seizures, this drug can be given. And also diazepam can be given to promote rest and avoid further impairment of neurological functioning, because if the brain is impaired, it doesn't need to be working to be working a lot. It has to be the patient should be encouraged to rest so that it can promote healing, as well as also you have to give diazepam, which can also promote rest as well. So when it comes to nursing management, of stroke, this condition is an emergency condition. So you have to use emergency management. So the first thing, you have to resuscitate the patient. So whenever we are talking about patient resuscitation, immediately you receive the patient who is in stroke. The first thing you do at the ward when you admit the patient is the patient resuscitation. So, and the resuscitation starts with ABC, airway, breathing, circulation. So you start by airway. You suction the patient if there is any presence of secretion using a suctioning machine so as to promote a patent airway. And you also tilt the head to one side for drainage of oral secretions and to prevent aspiration. And you also have to loosen tight clothing such as neckties or necklace so as to promote patent airway. Then after that, we talk about breathing. So breathing, you have to check the oxygen saturation levels. If below 90, you have to administer oxygen, because 90 is very low. You have to administer oxygen. Then also administer humidified oxygen, about 3 to 5 liters of oxygen per minute to promote tissue perfusion, because you find that even the oxygen supply to the brain is depleted, like we said, and in order for it to function well, it has to receive enough oxygen in order to prevent also further brain impairment. Also give air using ample bag to promote lung perfusion, and also nurse the patient in a well-ventilated environment to promote air circulation, and also place the patient in a semi-fowler's position to promote full lung expansion, and by doing so it will promote breathing. Circulation, you have to administer fluids with caution because the patient may have edema. So you have to make sure that you don't administer a lot of fluids, especially administer fluids according to the order by the doctor. because if you administer a lot of fluids, you find that it will accelerate the edema. Already we said this patient may have cerebral edema. Also administer prescribed fluids such as Ringer's lactate 5 ml per kg body weight to promote electrolyte balance, and also administer dextrose 10% to promote energy. Then after that, after you are done with the resuscitation, now you can continue with the normal eprophenema. So you have to talk about environment. Next, the patient in a clean and well ventilated environment, especially in the side ward or acute bay within the medical ward for his observation. This is the emergency condition, so the patient has to be near the nurse's bay so that it can be easily observed. Also provide a backrest, cardiac table, oxygen apparatus to promote rest and comfort. And also ensure that the environment has good lighting for his observation. And ensure that you perform damp dusting to prevent nosocomial infections. And you have to ensure that the room is free of unnecessary noise to promote rest. The position, you have to position the patient. If the patient, since this patient is unconscious, so we have to position the patient in lateral position for free flow of oral circulations, because if you let the patient lie flat, the tongue, especially this patient with the CV, sometimes they even they come in an unconscious state where the tongue has even come out of the mouth. So it means that tongue will be blocking the airway. So the best way to do that is to make the patient lie in a lateral position. Once we do that, it means that the tongue cannot obstruct the airway, and that will also promote the flow of secretion. Then you have to slightly, another point, you have to slightly elevate the lower limbs in order to relieve dyspnea. And once the patient is conscious, you have to nurse the patient in a semi-forward position using a backrest to promote full lung expansion and the pulmonary ventilation, because lying flat may worsen dyspnea. Then rest, you have to put the patient on total bed rest in an acute phase to promote quick recovery. Then you also have to do procedures in an organized manner to enable the patient rest. You also have to oil the trolley to prevent noise and to promote rest. You also have to limit the visitation of the bedsiders and also the visitors, so as to allow the patient to have enough time to rest. You have also to give prescribed sedatives such as diazepam to promote rest. Observation, you have to check the vital signs such as temperature, pulse, respirations, and blood pressure for baseline data. Then you have also to check temperature for 4 hours to rule out the presence of infections. And you also have to monitor blood pressure, which may further complicate heart failure if raised. And you have also to monitor respiration throughout respiratory failure. And you You have also to check the pulse throughout blood cardia, as digoxin can cause blood cardia. Psychological care, you have to teach the patient about condition to allay anxiety and to promote knowledge. You have to allow the patient to ask questions so as to allay anxiety. You have to explain all the procedures that has been done to the patient to allay anxiety, and you also have to involve significant others, especially caregivers, the bedsiders, other family members, to promote family support. Then in hygiene, you have to make sure that you bed bath the patient to remove debris on the skin and to promote hygiene. You also have to do oral care to promote good oral hygiene. You have to perform hair care to promote self-esteem. You have to do nail care. You trim the nails of the patient to prevent auto-infections. And you have also to change soiled linen to promote comfort. Exercise, you have to perform passive exercises to promote circulation while the patient is hospitalized. And once the condition improves, you have to encourage the minimal exercises to promote circulation and to strengthen heart muscles. So exercises are very important, especially when exercises you may also involve therapy, physiotherapy group, especially the physiotherapist in the hospital should be involved in the care, so that they can they can also promote the what they can also encourage on what types of the exercises the patient should involve in. Then under nutrition, you have to insert in a gastric tube to promote feeding while unconscious, and also have to give nutritious meals rich in proteins, vitamins, and minerals to promote nutritional status. You have to give food rich in carbohydrates such as rice and pasta to increase the body energy level. You have to give food rich in proteins to promote tissue regeneration. Another term we can say to also to repair the worn out tissues. Then also have to save meals attract in small amount in order to prevent anorexia, which is loss of appetite, and promote appetite. In medication, you have to ensure that the patient is taking prescribed drugs such as digoxin, furosemide, and paracetamol for headache, and you have to explain to the patient the importance of taking the drugs, their side effects, and the risk involved in not taking the drug. Elimination, you have to check the urine output and input using fluid balance charts so as to rule out urine output, and you have to observe for bowel opening throughout intestinal obstruction. Then advice on discharge, we will talk about drug adherence. Advise the patient taking prescribed medications such as patient to promote quick recovery. Also teach the patient on the side effects of the drug in order to raise awareness. Encourage the patient to report any side effect as soon as possible to the hospital for prompt management. Also talk about nutrition. Encourage the patients to be taking prescribed potassium supplements and eat potassium rich food such as banana, oranges, to replace that which has been lost through diuretic therapy and to promote electrolyte balance. Then under rest, you have to encourage the patient to ensure that he has adequate rest to reduce work overload on the heart that is weak. Also encourage the patient to avoid strenuous exercises as well as emotional stress that may worsen the heart failure. Hygiene, you also have to encourage the patient to wash hands before eating to prevent onset of other infections such as cholera. You have to encourage the patient to always take a bath regularly to promote hygiene. Then you also talk about the review date before the patient is discharged. You should encourage the patient on the importance of review on prescribed date at the hospital in order to determine the disease prognosis. So when we talk of so that's just a nursing care in case they asked you to write the nursing care for this patient who is having stroke. So that is the nursing care, which means this condition is an emergency, and the outline should come like that, where you have to start from the resuscitation. Then that's when you write the rest of the ibuprofen. So you have to resuscitate the patient because this patient is unconscious, and if you delay, this patient can die. So you have to make sure that you resuscitate. Once you stabilize the patient, that's when you can start doing other things. And then in case you are not asked to write the nursing care or the nursing management, other things that you are supposed to expect in an exam is a nursing care plan. So they may bring a question on cerebral vascular accident and they ask you to identify the 5 nursing problems and how you can draft a nursing care plan. So this is how it should come out. So the first thing, nursing care plan, there's a problem, nursing diagnosis, objective, intervention, stroke rationale, and evaluation. So problem number 1 that you may experience or that you may see in a patient with the CVA is impaired breathing pattern. And impaired breathing pattern in nursing diagnosis is related to paralysis of the chest muscles and the diaphragm, evidenced by dyspnea and labored breathing. So like we said, a stroke can cause paralysis, and once these chest muscles are paralyzed and the diaphragm is also paralyzed, it means that the patient can be having labored breathing, and how he may have difficulty in breathing. So this should be the nursing diagnosis: impaired breathing pattern related to paralysis of the chest muscles and the diaphragm, evidenced by breathing. Then on the objective, patient's breathing pattern will be improved within 30 minutes of hospitalization. So it means that when they go, you have to put the time that you expect this problem to be done, or to the patient is breathing pattern, how it can improve, for how long. So you have to make sure you indicate the time and the duration. Then intervention stroke rationale, have to suction the patient airway if there are secretions to clear the airway and prevent dyspnea. They also have to administer oxygen 4 to 6 liters per minute to increase oxygen perfusion and prevent dyspnea. And you also have to monitor the patient for dyspnea so that can note whether the condition is improving or deteriorating. Then you also have to monitor the respiration to see whether the respiration are within normal range or not. Then evaluation, you are just answering me the objectives that you have set. So you have to evaluate, has the condition or the breathing pattern improved? So here on the evaluation, you say patient's breathing pattern was normal throughout hospitalization, evidenced by respiration within normal range of 18 breathing per minute. So which means you have answered one problem. Then you go to the next problem. So another problem that you may find in a patient with the stroke, there will be impaired physical mobility, and the next thing diagnosis will be impaired physical mobility related to hemiplegia. We said hemiplegia, this is paralysis. So if the body parts are paralyzed, let's say maybe the legs are paralyzed or the hands, so they can be immobile, they cannot be moving. So they're related to the hemiplegia. So hemiplegia, this is the cause now. You relate the problem to the cause, then you evidence by what the patient is feeling or what you are seeing. So impaired physical mobility related to hemiplegia, which is the cause, evidenced by failure to move the limbs on the affected part. So now this is what you can see as an S. So this is the evidence. Then on the go, the patient physical immobility will be improved throughout hospital stay. So that's why we say objective has to be smart. So which means it has to be specific, measurable, realistic, and time bound. So which means the objective that we are putting here for impaired physical mobility starts within through hospital stay, because you cannot they cannot improve the physical mobility of the patient within 1 hour or maybe within 30 minutes. No. So it has to be time bound, which means within hospital stay. If it's 1 week or 1 month, whatever it will be. So that will be the objective. Then intervention and rationale. So have to do physical assessment to determine the extent of impairment. Then also do exercise the affected extremities passively to maintain joint mobility, regain motor control, and prevent development of contractures. Then also have to encourage the patient to exercise the affected side to prevent complications such as deep vein thrombosis. Then you also have to provide a wheelchair within the necessary to help with the mobility, especially when going out or when going to the toilet. You have to make sure that the wheelchair is available. Even when the patient is going for labs or for scan, for x-ray, you have to make sure that the wheelchairs are available in a working condition where you can put the patient. Then evaluation, physical mobility improved throughout hospitalization, evidenced by ability to move limbs and perform activities of daily living. Another problem that we can find here is self-care deficit, which is on nursing diagnosis, self-care deficit related to presence of hemiplegia, evidenced by the patient being unkept. Then objective, patient will carry out activities of daily living with the nurse's assistance throughout hospitalization. Then on the rationale, have to encourage the patient to carry out the personal hygiene activities as soon as the patient can sit up in order to improve the hygiene. Then you also have to assist the patient to bath in order to remove dirt and prevent infections, because these patients cannot even take care of themselves. Then you also have to encourage the patient to carry out self activities using affected hands, such as unaffected hands, such as combing hair, brushing teeth, and dressing to control grooming. Then you have to encourage the feed using an affected hand to improve the nutritional status. Then you have to assist the patient in meeting toileting needs using assistive devices such as wheelchair. Then evaluation, you say the patient was able to carry out activities of daily living with the nurse's assistance, evidenced by patient being kept. Then another problem that we can identify is the risks. So these are potential problems. Those problems that we discussed there, the three of them there, they're actual. So now these are potential problems. So we have risk for pressure sore formation. So risk for pressure sore formation is related to, this is under nursing diagnosis, related to hemiplegia resulting in decreased mobility. In objective, patient who have intact skin throughout hospitalization. Then interventions of rationale, change the patient's position at least 2 hours to prevent exerting pressure on the affected part, thereby preventing pressure sore formation. Then you also have to change soiled linen to prevent moisture, thereby preventing skin breakdown. Then you have to remove breadcrumbs to prevent irritating and breaking the skin. Then you have to straighten the bottom linen to prevent skin irritation. Evaluation, patient maintained an intact skin throughout hospitalization, evidenced by absence of pressure sores. Then also have the last problem, which is risk for impaired nutritional status. So anything diagnosed risk for impaired nutritional status related to impaired feeding as a result of unconscious state and paralysis. So you find that these patients are unable to feed also properly because they are in unconscious state and they are paralyzed. So the objective of the patient to have improved nutritional status throughout hospitalization. Then on interventions to rationale, insert a nasogastric tube and give feeds to promote the nutritional status. Then give foods rich in proteins, vitamins, minerals, and carbohydrates to improve the nutritional status. Then once the patient is unconscious, once the patient gains conscious, encourage the oral foods and fluids to promote nutritional status. Then also check the weight of the patient frequently to rule out malnutrition. Then evaluation, patient's nutritional status improved throughout hospitalization, evidenced by normal body weight for age. So complications, the complications of stroke, one, we have pneumonia due to aspiration of secretions in unconscious state, especially if the patient is not laid properly. Like we said, when the patient is having stroke and this patient, they come in unconscious state, so I have to make sure that you position the patient on the lateral position and to avoid aspiration of secretions. But if you don't do that, you may find that the patient will be aspirating the secretions, which can cause aspiration pneumonia. Then you also have permanent paralysis of the limbs and the facial muscles. So we find that if this condition continues, it can permanently paralyze the limbs of the patient as well as the muscles of the face. Then contractures, the patient may have contractures, and also another complication, sensory impairments, and you can also have visual impairments, speech defects. These may they can lose sight. On visual impairment, we find that the patient may lose sight or even blindness at some point, and also speech defects. Also, they can stop speaking. This is also another complication of stroke, and also altered gait, which is the manner of walking and running, so maybe changed. So the way the patient walks and the way the person runs may be changed due to impairment in the brain cells, and also epilepsy. So this patient may have epilepsy, some seizures, and cerebral damage. So we find that it can cause brain damage as a complication. All right, so this is where we end with today's lecture on cerebral vascular accident, which is also known as a stroke. Thank you for watching. See you in the next lecture.